There's this very specific image we all have when we talk about marijuana. It's the chill drug.
Absolutely.
It's all about relaxation, slowing down, the antidote to a stressful day.
It is. And that cultural idea is what makes the medical reality so jarring. Because if you look at the physiology, chill is the last word I'd use.
Right. And that's exactly why we're doing this deep dive. We've got a stack of research here. Papers from the Journal of the American College of Cardiology, the American Journal of Medicine, European Heart Journal.
Some guidelines from Bangkok Heart Hospital, too.
And we're going to try and bridge that gap, the gap between the perception and what the clinical data is actually telling us.
And the data is telling a story that's closer to a panic attack than a nap. Your brain might feel relaxed, but your cardiovascular system, it's often running a marathon it wasn't prepared for. It's this huge paradox.
I saw a phrase in one of the papers that really stuck with me, an autonomic tug of war.
That's the perfect description.
It just sounds so violent. And that's our mission today, to unpack how THC causes that, why there's this hour of danger after use, and why cardiologists like you are seeing a whole new kind of patient.
That last point is so critical. We're not just talking about older patients with known heart disease. We're seeing young people, 20s, 30s, otherwise healthy.
Showing up with heart attacks.
Heart attacks, arrhythmias.
Yeah.
And the one common thread is often cannabis. And with legalization expanding so fast, this is a clinical blind spot we have to talk about.
Okay, so let's start with the basic mechanics. I think most people assume it's a brain drug, right? It goes to your brain, you feel the effects, and the heart is just sort of a bystander.
That's the common assumption, but it's physiologically wrong. We have to talk about the endocannabinoid system.
Which we have in our bodies naturally.
Exactly. We used to think its receptors, the CB1 receptors, were mostly in the brain, but we now know they're all over the place.
Where else are they?
They are all over the cardiovascular system, on the actual muscle cells of the heart, the myocytes. They're on the lining of your blood vessels. They're even on your platelets, the cells that form clots.
So when THC enters your blood, it's not just passing through the heart on its way to the brain.
No, it's binding directly. It's talking directly to your heart muscle, your arteries, your blood itself.
And what's the first thing it says?
The first thing it does is create what we call hemodynamic chaos.
Okay, break that down for us. What does that chaos look like in the first few minutes?
It starts by hitting the gas on your sympathetic nervous system, your fight or flight response.
So instant stress signal.
Instant. You get a spike in heart rate tachycardia and a surge in blood pressure. Your heart starts pumping harder, faster.
Which is the total opposite of how the user feels.
Precisely. But here's where the tug of war really starts. While the gas pedal is floored, THC can also stimulate the vagus nerve.
Which is the brake. The rest and digest system.
Right. So you have one system screaming, go, and another one whispering or sometimes screaming, stop, at the very same time.
That sounds incredibly unstable for the heart.
It is. You might have a racing heart 1 second, and then a sudden drop in heart rate bradycardia, or your blood pressure could bottom out. It's an electrically volatile environment.
It's like revving a car's engine while slamming on the brakes. Something's got to give. And this brings us to this idea from the research, the supply and demand mismatch.
This is cardiology 101. The heart is an engine. When it works harder, it needs more fuel.
And the fuel is oxygen.
The fuel is oxygen. Because of that sympathetic spike, the racing heart, the heart's demand for oxygen goes way, way up.
Okay, so demand is high. What about the supply of oxygen?
Well, this is key. If you're smoking it, you're inhaling carbon monoxide, just like with tobacco.
Right.
And carbon monoxide loves to bind to hemoglobin, the oxygen carriers in your blood. It kicks the oxygen out and takes its place, creating something called carboxyhemoglobin.
So the blood cells can't carry as much oxygen as they should.
Exactly. So picture this. Your heart muscle is sprinting, screaming for more oxygen. But the blood arriving at the heart is carrying less oxygen than normal.
You're starving the engine right when it's under the most stress.
And that mismatch is a classic setup for a heart attack. This brings us to that hour of danger you mentioned.
This statistic was stunning. The risk of a myocardial infarction, a heart attack, goes up nearly 4.8-fold within the first hour of use.
Almost 5 times the normal risk. It is a very specific, very acute window of danger.
So we have the oxygen mismatch, but what's actually, breaking? What causes the heart attack itself?
There are a few things happening. One is plaque rupture. A lot of us have some plaque in our arteries. It's just sitting there, stable.
Not causing any problems.
Right. But that sudden surge in blood pressure, that hemodynamic stress, can literally shear the plaque off the artery wall. It ruptures, the body forms a clot, and now you have a blockage.
But there's another mechanism, one that can happen even in people with perfectly clean arteries.
Yes, and this one is, in some ways, even scarier. It's called coronary vasospasm.
This is where it looks and feels like a heart attack, but when you look inside, the plumbing is clear.
That's it. We see these patients, they come in with crushing chest pain. Their EKG looks like a massive heart attack, a STEMI. We rush them to the cath lab to open the blockage.
Yeah.
And there's nothing there. The arteries are wide open, pristine.
So what happened?
The drug caused the muscle in the artery wall to spasm, to clamp completely shut. It cuts off blood flow just like a clot would. Eventually it relaxes, but by then,
The damage is done. A ghost heart attack.
the damage is very real. And there's a third factor, too, the platelets.
You said THC binds to them.
It does. The research shows it has a procoagulant effect. It makes your blood stickier, more likely to form a clot.
So you have a racing, oxygen-starved heart. You have arteries that might be spasming shut. And you have stickier blood.
It is the absolute perfect storm for a cardiac event. And we're seeing this play out in the data, particularly in the Partners Young MI registry.
That was the study on patients under 50, right?
Yes, people who should not be having heart attacks. And in that group, they found marijuana use was reported in over 6% of cases.
That's a pretty significant number for that age group.
It is. But what's even more concerning is the outcome. The marijuana users in that group had a higher risk of dying after their heart attack compared to non-users.
So it's not just a trigger for the event. It makes recovery harder, too.
It seems to complicate the entire picture. It just shatters the narrative that this is harmless for young people.
Okay, so we've talked about the plumbing, clots, and spasms. But the heart's also an electrical organ, and it seems the wiring is just as vulnerable.
The rhythm section, absolutely. The range of arrhythmias or abnormal heart rhythms we see is incredibly broad. It all goes back to that autonomic chaos.
The case series in the European Heart Journal was wild. What stood out to you?
The sheer diversity. On one end, you have the fast, chaotic rhythms, tachyarrhythmias, atrial fibrillation or AFib, even ventricular tachycardia, VTACH.
So with that one case of the 30-year-old.
Yes, a 30-year-old daily user, perfectly normal heart structure, but he developed polymorphic VTACH.
How bad is that for those of us who aren't cardiologists?
It's lethal. The bottom of the heart is just quivering, not pumping. If you don't shock them out of it immediately, it leads to sudden cardiac death. In his case, they found no other cause. He stopped cannabis.
And it went away.
It just went away.
Terrifying. But then, true to the tug-of-war theme, the paper also talks about the exact opposite problem.
Exactly. Severe bradyarrhythmias, the heart slowing down dangerously. There's a case of a young man with heart block.
Where the signal doesn't get through properly.
Right, the signal from the top of the heart gets blocked on its way to the bottom. And another who kept fainting, syncope, because his heart rate was dropping so low.
That seems like a diagnostic nightmare for a doctor. How do you connect these opposite problems to one thing?
Well, that's the clinical pearl. The expert commentary suggests that this ambiguous combination of rhythms is the clue. A young patient, healthy heart, but they're swinging from fast to slow rhythms. You have to suspect cannabis.
I also saw mention of the Brugada pattern. That just sounds scary.
It is. Brugada is a genetic condition that dramatically increases the risk of sudden cardiac death. Some people have the gene, but it's hidden, unexpressed.
And cannabis can? What, reveal it?
It can unmask it. The drug can cause the telltale pattern to appear on an EKG in someone who never knew they were at risk. It's like a hidden landmine.
I want to shift to a group that might be at the highest risk people already on heart medication. Let's call this the liver traffic jam.
A perfect metaphor. This is all about the cytochrome P450 enzyme system.
Sounds very technical.
Think of it like a crew of workers in your liver. Their job is to break down and clear out dozens of common medications.
Okay, so where does marijuana come in?
THC and CBD are potent inhibitors of these enzymes. They basically distract the entire work crew.
So while the crew is busy with the cannabinoids,
the other drugs just start piling up. Their concentrations in your blood can rise to toxic levels. It's like you took 2 or 3 pills instead of 1.
What are the biggest danger zones here?
Warfarin is a huge one. It's a blood thinner. If its levels spike, your blood can become too thin, and you're at a massive risk of a major bleed, like a brain hemorrhage.
And statins. So many people take those.
Levels can rise and lead to severe muscle pain and weakness, what we call myopathy.
What about common blood pressure pills?
Beta blockers, calcium channel blockers. If their levels rise, your blood pressure or heart rate could drop dangerously low. You could faint while you're driving.
And the really scary part is that patients often don't tell their doctors about their cannabis use.
Exactly. So the doctor is flying blind. They prescribe a normal dose, not knowing that in this particular patient, it's going to act like an overdose.
This all raises a big question. Why don't we have better data? Why is it all case studies and registries?
It's a simple, frustrating answer. Bureaucracy. In the United States, marijuana is a Schedule I substance.
Same category as heroin.
Which makes it almost impossible to conduct randomized clinical trials, the gold standard research. So we're stuck with observational data, which is never as clean.
And the product itself isn't standardized, which has to be a problem.
A massive problem. A joint today is not what it was 30 years ago. We have to talk about vaping.
Higher potency.
Exponentially higher.
Oh.
We're talking about concentrates that are 80–90% THC.
Wow.
When you vape that, you are delivering a huge instantaneous shock to the cardiovascular system.
So that hemodynamic chaos we talked about is probably much, much worse.
We have to assume it is. We are in completely uncharted territory with these new products.
Let's get into some practical advice.
Yes.
The Bangkok source had some really specific warnings. One was about caffeine.
Yes, this is a key takeaway. Caffeine and cannabis seem to have a synergistic effect. They're both pushing on that same fight or flight gas pedal.
So an energy drink and a vape.
Is a recipe for trouble. The guidelines are clear. Combining high caffeine intake over 400 milligrams with cannabis significantly increases the risk for arrhythmia.
They also had a list of contraindications, people who should just not use it at all. Who's on that list?
The red lines are pretty clear. Anyone with established coronary artery disease. If you've had a heart attack, a stent, angina, your heart can't handle that supply-demand mismatch.
Who else?
Patients with heart failure or known arrhythmias, and, importantly, people under 25.
We usually hear that in the context of brain development.
We do, but as we see with the Young MI data, their cardiovascular systems seem to be especially vulnerable to these events. The risk is just too high.
Okay, last practical point. Let's say someone is using and they feel that panic, their heart is racing, they're dizzy. What's the first aid?
First, obviously stop using.
Yeah.
But they recommend drinking something sweet, like fruit juice.
Sugar helps.
It seems to help stabilize things metabolically. They also suggest a warm shower.
Not a cold one.
No, you want to dilate the blood vessels in your skin. A warm shower pulls blood to the periphery, which can help lower your core blood pressure and ease the strain on the heart.
But there's a huge caveat here.
A massive one. If there is any chest pain, any shortness of breath, if the palpitations don't stop, you get medical help immediately.
Don't write it off as just a panic attack.
Never. Time is muscle. It's better to be wrong in the ER than right at home and too late.
So as we wrap up, what's the single biggest takeaway when you look at all this research?
For me, it's that the endocannabinoid system isn't just about mood. It is deeply woven into our core cardiovascular function. We have clear evidence THC creates this chaotic environment, this hour of danger, and it throws a wrench into the works for anyone on heart medication.
It really dismantles that idea that natural means safe.
Absolutely. Natural does not mean cardio-safe. This is a potent, biologically active compound.
I want to leave our listeners with one final thought. Imagine if a new drug came out today, and the early data showed it increased heart attack risk by almost 5 times in the first hour. It could cause arteries to spasm shut, and it dangerously interfered with common heart medications.
It would never get approved. Not a chance. The FDA would shut it down in a heartbeat.
Exactly. And it makes you wonder, with the rise of these unexplained heart attacks in young people, how many are actually unrecorded cannabis reactions that we're just missing?
That is the question that keeps cardiologists up at night. We are likely only seeing the tip of the iceberg.
A huge thank you for breaking all of this down for us, and thanks to all of you for listening to this deep dive. Stay curious and take care of that heart.